I'm Mina Malik Hussain and you're watching The Coffee Table. And you know, we love to talk about science on this show because I am a big science nerd. And so today we have two very interesting people on the show to talk to us about burns. And, you know, how do they happen, how to treat them, and treating them not just physically, but also mentally and emotionally. So we are welcoming back on the show our favorite psychologist, Iram Irshad, who is a positive psychologist, and Dr. Afzaal Bajwa, who is a plastic, cosmetic, and burn surgeon, and also an assistant professor at the Mayo Hospital. Hello, Dr. Saab.
Thank you very much. Mina, how are you?
Very well, thank you. It's always sort of, you know, when someone's physically on the set, it's always such a surprise for me these days. I'm like, there's a person right here. Hello, Iram, from far away.
Hello, how are you? Thank you, Mina,
well.
for inviting us.
Thank you for being on the show, as always. We love to have you on.
Yes, I'm so excited.
Yes, this is going to be a really interesting conversation. I'm really looking forward to it. So let's sort of like dive right in, Dr. Bajwa. So you're a plastic and a cosmetic and a burn surgeon. These are very many things to sort of put in together. So let's begin at the beginning. There seems to be a difference between plastic and cosmetic surgery. What is that?
Yeah, actually, plastic surgery is a very vast field.
Okay.
Plastic mean is, it's not that plastic. That people think that we are using some plastic in the treatment. No. Plastic mean is basically a derived verb from the Greek sentence, and it means something to make better.
Right.
To mold something, to make something better. So plastic is from plasticos.
Right.
So plastic surgery is to make anything better.
Right.
And if we talk of plastic surgery, it has many aspects. Like we can deal with reconstruction, every trauma, you know, cut of the organs, lacerations, wounds, they need to be stitched back.
Right.
It is done by a plastic surgeon. Burn is one of the major part and major chunk to be dealt with the plastic surgeon. And same is with the congenital events, like you have seen the cleft lips, palates, they're all dealt by plastic surgeons.
Right.
And in one of the chunk as well, that we also deal with the cosmetic and aesthetic surgery.
Yes.
Because aesthetic and cosmetic, how we do with cosmetic and aesthetic actually, how we differentiate reconstruction and aesthetics. The thing is, there is a minor difference.
Right.
Why? Because if something is aching your mind, it's not good, it's coming down with age, you have to reconstruct it back.
Right.
It's again a reconstruction, and it's for the reason that it's aching your mind.
Right.
You're not feeling good. You want to be having good again.
Yes.
So it's aesthetic surgery.
Right.
And if it's something, you know, it's esteemed by, it's having laceration, it's having wound, then it has to go with the reconstruction. So there is a subtle difference between aesthetic and, you know, the reconstruction.
Right.
So we are dealing with cosmetic and aesthetics because it's a sort of reconstruction.
Right. And I think that's an interesting and important distinction to make, because a lot of times when we think of this kind of surgery, it's one usually thinks of it cosmetically. So, you know, you're going to fix your nose, you're going to get a jaw lift, or, you know, do something to your face or do something to your body, which is just sort of for your own sort of
from
happiness.
head to toe, we deal with every organ.
But reconstruction...
You've heard of hair transplant, you heard of the eyebrows, they come down with age, we can elevate them, you deal with, you know, you have come across
here, like, many things that can be done.
Wrinkles on the face, with the lip changes, with the nose, with these jawlines.
There's like infinite things that can be done.
We're dealing with every part of the body.
But
and the same is, you know, you will be surprised. I worked someday in Emory University, Atlanta, and there I was working in aesthetic breast surgery. It's, you know, every organ, you must be having a concept of aesthetics of the hands. You go with the manicure, pedicure, it's a smaller thing. You're taking care of your nails. But how to take care of your, you know, aging skin and these wrinkles on the hands, they can be dealt with. So it's aesthetics involves from the head to toe. And aesthetic is basically give you high esteem of your own body.
Quite right. But also, and this is something that we'll talk about in more detail, is that reconstruction of, like you said, congenital issues or accidents that happen, like burns, for example. And those are things that have a massive impact on our self-esteem and our perception of ourselves. And that's something that we're kind of going to sort of go into more detail about. But before we do, Iram, hi! This one to sort of rope you back in here with us.
Yes, yes.
We're talking about self-esteem, and we're talking about how, so sort of how much of our self-esteem is tied to how we look and how we sort of present ourselves to the world.
I think, Mina, it's a very fundamental understanding of ourselves, because I believe that spirit is basically is like housed in your body, and before I reach out my soul and spiritual needs, I understand myself through this body, and my self-identity is primarily based on this physical appearance. And I would also like to highlight this over-demanding and extremely perfect world where it's not only the stress on these victims or the people, those who go through certain traumas and tragedies of burn or any such unfortunate event. I think it's on all of us, and this body image and consciousness of your appearance is it matters a lot to us. So the moment we are faced with such type of scenario where we have to lose some part of our body, or we are de-shaped or defaced, I think it has a immense stress on your mental health. And the study says that almost 1/3 of burn victims, they go through severe acute depression after this tragedy. And I think to some extent our cultural understanding, and in fact it's not related with any civilized or less civilized society. I think it is across the board, all over the world. People want perfection when it comes to people around them. So instantly you are outcasted. Many of your opportunities are seized because either you are not looking normal, right?
Yes.
So there are many media, movies and dramas which has been highlighted that how a woman goes through certain, social criticism after face burn or anything like that. So
that's
and I think
yes.
So it's a reality that the world does not remain the same after you face such incident. And whatever Dr. Saab is saying, with no offense, again the target audience of Dr. Saab is like still limited, because not everybody can access to these aesthetic remedies, and most of us, we are suffering silently. Even we cannot go to any counselor or psychologist to address this extremely personal tragedy, because yes, you have recovered, you have survived from it, but you are not thriving, you are not acting normal, and nobody is bothered to take care of you extra because you have gone through that. Burden lies again on your shoulders to do extra work to heal yourself.
Yes, and I think it's very important here to emphasize that it is an incredibly personal experience, an incredibly personal journey that you have with, and that relationship that you have with your own body. So, Dr. Saab, could you tell us more about burns? So, what kinds of burns are there?
Iram was very nicely, elaborating this aspect. Change is in two ways. One is born with the things which is not matching with the normal society.
Right.
It's a congenital disorder. As we talk of the cleft lip and palate, and even cleft of the hands, cleft of the urethral tract, even cleft of the feet. It's not only restricted to the face.
Right.
It's not matching with the normal.
Yes.
And the second is, one was born normal, and later on, he or she gets a trauma or the burn, and now he is or she is not matching with the society.
Right.
It's a change.
Yes.
And physiology and psychology always reacts to that.
Yes.
There's always a change. And these reactions of the body, they are sometimes very, very hazardous, and they are very, painful for the patient. They are miserable. They need to be reconstructed.
Yeah.
And even after 4 years of age, one starts esteeming itself.
Right.
And it's recommended that the congenital issues, they should be dealt in before the age of going to the school.
Okay, so maybe like 4 or 5.
4 or 5 years, of course, that is. Because it leads to the baby is ultimately going to be into the society and going to skill. and then it has to face the peer pressure.
Yes.
And the same is with the adults are afterwards they're getting burns, and particularly the burns of the face.
Yes.
And the apparent areas, which are not hideable.
Yes.
And when I was having my MPhil from Punjab University in public health, I was working on that, how people, they abscond from the society, how they start avoiding the society once they are having something wrong with the face and with the hands. It has been always noticed.
Yeah.
So we have to reconstruct and get these people back to the society. And I have always seen many changes in these people, and even you can detect them right on the first sight. Like if a person, a male patient, a male person is coming in front of you, and they come to my outpatient department and they are having very long hair.
Yes.
And I immediately talk to my, subordinates, my junior doctors, that he is having something wrong with the ear, because he is hiding it. He's hiding it. And then they tell us that they are having, by birth they are having no ear, and which we call it anoxia.
Wow.
Or they can have a trauma or the burn losing their hair, their ear. And ultimately they grow up the hair in the style. It's a body change. It's a body response. And the same is with people, they start taking the abaya to hide these areas. They start making the tattoos. Like if somebody is having burn and loss of the eyebrows, they start with, these
tattooing it or penciling
of these
in
areas to look it to be normal. And it's basically wish of the person to look better and look normal.
And then sometimes maybe, and in cases of this kind of trauma that you're describing, it's not it's unfair to say that they're being vain. It's not about vanity. It's about just wanting to fit in with everybody else.
They have to be actually, there are two thoughts. One is to be matching with the society. And the second thought is to looking even more better.
Yes.
So it's basically they are deemed and they want to be. It's normal. It's not abnormal.
Because I feel like sometimes there is a judgment, a sort of judgment value placed upon wanting to look better as well. But the thing is, in somebody who doesn't have an ear, it's very normal to want to have two ears. I really don't feel like
there is always
anybody
an interplay between society and the body. So society has to accept it either, or the body should be normal to be accepted by the society. And this way is in the limits of the person. He can't, influence or force the society to accept that. It's one way. But it's the other way that you have to change or adapt your body in the way the society is accepting it.
Quite right. And society also then needs to have a more open mind and to be kinder and to have more empathy towards people who look different.
That is actually, one part is in the limits of the person. He must be bold enough to face the society. And second is to us and to you particularly to educate the society that it's an accident, it's a trauma. He got burned. It's not his limits.
Exactly.
It's beyond his limits.
And one deserves more understanding than that.
We should give them respect. We should give them honor. It's basically to create an awareness.
Quite right. Yeah, we're just going to take a very quick break and come back to this fascinating conversation. Stay with us. Hello, welcome back to the coffee table. We're having a really interesting conversation about societal acceptance, about our self-esteem, about the way we look, and we're also talking about burns and burn trauma. So, Dr. Bajwa, let me reiterate my question before we started philosophizing. What kind of burns are there? What are the main kinds of burns?
A burn is basically, it's a denaturation of the protein. Body is most of it is protein, like cells and all. It's basically a denaturation of the protein due to extreme of temperature.
So denaturation means?
They are basically destruction of the nature on which they have been
So
produced.
Like proteins are cells and then something goes
cells, and they ultimately they clump up. As you have seen, that we have an egg, we broke it, put it on for roasting in the pan, it has a certain changes. It shriveled up and it contracts, it becomes hardened, it's denatured.
Yes, this is denaturing. Science lesson, a mini science lesson for you, audience.
Yes, it's a denaturing. And egg is also a cell.
Yes, and it is protein.
It's a protein. So it's also have some other elements as well. It has cholesterol, it's vitamin A and so on.
But let's focus on burns.
But focus on burns.
Like eggs.
But we have a big way to go.
So proteins in skin get denatured by...
The skin is basically, it's not just only skin. Electrical burns, they even go to the destruction of the inner parts as well. So it's basically denaturation of the body proteins due to one, extreme of temperature. It can be due to certain chemicals. It can be due to electrical current. It can be due to friction.
Oh,
friction.
Okay.
So extreme of temperature, if we talk in first stance, it's not only, most of us, we are concerned and we feel that only heat leads to destruction of the body and leads to burn. No, extreme of temperature, extreme high temperature and extreme low temperature.
Ah, of course.
You may have heard about the frostbites.
Yes.
If you hold ice cube into your fingertips, after about half a minute or 1 minute, you have to drop it.
Yes.
It's very painful. And if unfortunately you have to hold it for longer time, it causes blisters.
Ooh.
So it burns. So extreme of temperature leads to burn of our body covering and outer parts. Electric currents, if we go on in contact, unfortunately, it travels to the body. It leads to destruction of the bones, muscles, and inner tissues as well, and particularly the nerves.
Oh.
Yeah. It leads to acids and bases like alkalis. They also lead to, you have heard about the acid burns.
Yes.
And they also lead to destruction. Friction also causes burns, like somebody dashed to the ground and rubbed again. It also produces heat. If we rub our hands.
Yes, like if you know when people have accidents and people fall off motorcycles and then you go
they dash again
on
and
the road.
they are rubbed against the road.
Or like rope burn.
They got friction burns. And you know, if we rub our hands, we produce heat.
Of course.
And if we keep on rubbing against the surface, which is not yielding, it produces a lot of heat. It's again a burning process.
Right.
So these are different types of burns, and we have to react according to the variety of the burn when the patient presents.
Right.
And different parts and different types and different areas of involvement have different care which we provide to the patient.
Right. So, and then there are also different intensities of burn.
Yeah, there
right?
are different intensities because there are certain levels and certain layers of the covering of the skin.
Right.
And if this, it can be classified into 4 different degrees.
Right.
Like the first degree burns, they are very superficial. As we go into the sun and, you know, roaming in the northern areas, you are blushed.
Sunburn,
It's actually not a blush, it's a sunburn. You just touch to some hot element like iron and you just pull the hand back. It's just causing redness and little pain.
Yes.
It's the first degree burn. In the second degree burn, the outer covering is partially damaged. It's basically epidermis and then there is a dermis.
Yes.
In first degree burn, just epidermis is involved. And in the second degree, epidermis and outer part of the dermis, which is the deeper layer of the skin, is involved. In the third degree...
So it's kind of like 1.5 layer.
Yeah, 1.5 layer.
So usually what are those kind of burns called?
1 and 1/3.
Okay.
1 and 1/3. If it is involved to the deeper, like upper layer is also, you know, involved and the lower one is half involved, it is the third degree burn.
Wow.
And if it is the upper layer is involved in the whole and lower is also involved in the whole, it's a 4th
Wow, I didn't even know that there were 4 degrees. I thought that there were 3.
It's surprising.
Oh my God.
Because they must be known to everybody. Why it is so? The reason is very, very obvious. Why? Because we have to decide about what modality and how we have to treat these burns. Like first degree burns and second degree burns, they just require your attention.
Okay. What kind of attention?
Yeah, that I'm talking about. That we need not to further damage it. Like if we touch it, we pull it back and immediately we have to pull this area under a tap water.
Okay.
Tap water. Any burn can be put under tap water except the electrical burns. And electrical burns are only for the time when you are switched off, you are away from the wire, then you can put it under the tap water.
Okay, so once you've removed yourself from the source of electrocution, then you can go near water.
You can put water.
Okay.
Before this, you can't put water. Otherwise, rest of all the wounds, they can be washed with water and they should be.
Oh, all right.
They should be for my audience. It's very, very important. That it should be put under tap water at least for 5 minutes. At least for 5 minutes.
5 minutes? Okay, so basically going to cool it down.
No, it should not be rapid cooling. That it's not that you got burned and you put ice water on it.
Oh, okay.
No, it will be further damaging because on one extreme you are going to the other extreme.
Okay. So do not ice burns.
Yeah, you must, you know, first quit from the source and then put it in the tap water under the room temperature.
I think at this point Iram wants to jump into the conversation. Yes, Iram.
I would pick from your societal acceptance. I think before these victims get societal acceptance, they should for self-acceptance. What happens that when you meet any kind of such unfortunate event, there is a shame involved in it. We feel ashamed that I have lost some part of me or some organ, or I damaged my hand, face, body, and now how would I survive in this, perfect world? My relationship would get affected, my work choices would get affected. So a person goes through a lot of trauma in that context where he or she feels ashamed.
Quite right.
So, and since we are not trained to accept ourselves, although we have a very different standard for our loved ones, let's say if we see our parents and they unfortunately go through some tragedy of some fracture or some, burn or anything, we try to be very careful and loving and caring for that. But when it comes to us, we criticize, and sometimes we get into self-hate and self-loathing, and that is why we try to develop a behavior which is antisocial, and we like to hide from people because people would obviously spot on the weak area.
That's
and we are not normal anymore.
So what you're sort of saying is that when we learn to ourselves, then it becomes harder for other people to make us feel unloved.
Yes, and it's not only self-love, it's basically accepting the imperfection that you have faced now. It wasn't your choice. You have to accept the new reality, just the way we are accepting this new pandemic and it's a new normal. A lot of people are still struggling to understand that why should we wear mask, and I think it's more than 4 months now. Same is the case with tragedy. When something of this nature happens, we take long time to understand and make peace with this new situation. And as I'm saying over and over again, that we are not conditioned to accept ourselves unconditionally.
Yes.
We try to win people, and we try to win attention and love through certain, benchmarks to achieve.
Quite right.
And when we see that fundamentally there is a flaw now, and I just cannot repair it. Let's say if I have the budget, I can fix it to some extent, but again, it's not perfect. So it causes
absolutely. Yeah, and we're just going to cycle back to this because in a way, because we are sort of focusing on burns today, I want to kind of cycle back to how to treat the burn and sort of do's and don'ts. And then I think part of treating the burn is what you've talked about, Iram, is about acceptance also, because I'm sure there are sometimes and some instances where medical intervention doesn't work. And again, that's something I want to sort of address in, a little while. So we were talking about the do's and don'ts of burns, right? So like don't ice a burn, and you can put it under water. And these are for household burns. So when people accidentally tip boiling water on themselves, that happens a lot in home. Is that a second, or what degree burn is that?
It depends on, Iram, how hot the water is,
right,
and how long it remained in contact with. So it depends on it. It's never been first degree. It's always been second degree or third degree, and sometimes, unfortunately, to the fourth degree. I was talking about when this unfortunate event happens, any place, like even simply on the way, if somebody accidentally opened up the radiator and has spilled up the hot water, it can happen in the office.
Yes.
It can happen anywhere.
It can happen anywhere.
Anywhere. And nobody is immune to burn. Anybody can, right from
quite right. You can't just sort of magically be like, I'm not burning at all.
True.
So I'm now again curious. And I'm again wanting to sort of talk about household instances of burning.
That is, I was coming about that when something has happened to, what we should do, one, we should omit the source. We should be away from the source.
Okay.
Right? And the second one is we should be under putting the part which is burned, and we should immerse it under tap water.
Tap water, not ice water, just
not
tap.
At least. We should, I have seen many, mistakes, many blunders done by my people, and that is in the form of people, they're putting paste.
Yes, that's a real sort of, sort of standard thing. Put toothpaste on it.
They're putting, these are the atta, and they are putting, so many like mashed egg. They are creating these masses.
Don't do that. No toothpaste.
They never,
Dr. Bajwa has busted this myth.
It should be condemned. Everybody should be told that never, for God's sake, never do it. Just put it under tap water, make it dry, and if it is, there are certain criteria when we have to run and rush to the hospital. But before hospital, one, again I will say, omit the source, be away. Second, put it under tap water, avoid these household things which we are putting on it.
No household remedies.
Why? The reason is, why? Because, our skin is one of the very strong and good barrier to protect us against the invasion of the bacteria. These bacteria, viruses, they are all around us in the air, in the dust, in all these areas. They are even in these atmosphere as well. But we are lucky to be protected by our skin. And if unfortunately skin is burned, these areas are open. And if we are putting these, things, they are non-sterile. And unsterile things, if we are putting on it, they're causing infection. And ultimately, if infection comes into play, if the burn is 2nd degree, it will be converted into 3rd degree. It is 3rd degree going into 4th degree because it's further damaging. Because these bacteria, they join hands with the burning process. And half of it is already gone with the burn process. The next half is destroyed by the bacteria. So we have to avoid it. There is a criteria when we have to consult to the burn surgeon or go to the hospital. If it is involving like a significant areas, but significant area mean if a small tip is touched, you need not to go. You just put it in the tap water and just observe it for a while. If it is normal, your pain settles down, you can take paracetamol, which is available at home. And if it is settled, take care of it, it heals by its own. And if it doesn't, you can consult him. And if a significant area like whole of the hand, like face area, like any other body area is involved, which is more than the size of your palm.
So more than the size of your palm is a big burn.
It's considered to be 1% of the body. You should consult to the doctor. And if it is even a smaller part, and if it is deeper, and if it is even electrical burn, Mina, you'll be surprised. Sometimes electrical burns, the burn itself doesn't cause that much harm to the patient. That electrical current may cause death of the patient.
That's true.
Because it passes to the body and it can change the beats of the heart.
Quite right, yes. And so on the skin, it looks normal.
It looks normal. It's a smaller wound just at a pinpoint. And if it's electrical burn, and it can change the rhythm of the heart and can result into the heart attack. And it can even destroy to the kidneys. So it can lead to major, which is beyond imagination. So all the electrical burns, if the person is feeling that he is not well, he or she should be taken to the emergency of the hospital. Should be seen by the patient, by the doctor. So this is a way how you should behave in.
And what about clothes? So if you have got, let's say, a fire burn. So, and your clothes are stuck to the burn. So should you cut them off?
We should remove them immediately.
You should.
Because most of it is polyester. The cloth, they carry polyester, plastics, the cotton. These hot elements, they retain their heat and they are continuously in contact. And even more than the clothings, these, the jewelry. You see, if we have something, we heat them, they retain heat for certain moment of time. And they remain in contact, the bangles.
So they might be burning you.
They are further damaged. They are further damaged. So we should
getting really serious now.
we should immediately remove these.
So you should cut off if there's cloth stuck to it.
Remove the jewelry.
But it's stuck to your burn.
Unfortunately, if we immediately do not remove the jewelry, the distal parts, they are swollen. And then it's very difficult to remove them. So as early as possible, remove them. Remove these clothing, cut them off. But before removing, you do consider that everybody has to cover the patient. Why? One is for privacy and the second is for hypothermia. It's basically the loss of the heat from the body because the skin is a good barrier to the heat. It's lost. Now the patient can lose heat. Even in summer. Now I'm not talking only in the winter. In the summer, you can have the patient which are going into hypothermia because the internal body heat is not conserved.
Wow, that's fascinating. There's fire on the one hand and then there's hypothermia on the other. And we're going to just take a very quick break because this is a really good conversation and I want to continue it as soon as possible. Stay with us. Hi, welcome back to the coffee table. We're talking to Iram Irshad, our favorite positive psychologist, and Dr. Afzaal, who is a plastic, cosmetic, and burn surgeon, about burns and how to treat them, and really in this segment, how to live with that as well. So, Dr. Saab, tell us about, we've been talking about how to treat burns at home and, what can you do and what you shouldn't do. But what happens when now you have got a burn? Now, whether it's an acid burn or it's a fire burn or it's a chemical burn or electric, whatever it is, you've got it now. And now you're in the hospital and now you need to be treated because now we're talking about major burns now. So these would be third or fourth degree burns.
Mina, basically any category of the burn when it's brought to the hospital or when somebody got burned. Burn is not a simple process.
Right.
And it's not only the wound which we have to take care. It's a multimodality treatment, care, and support which the patient needs to be. And we have to support them in many ways. It's a holistic care.
Right.
Like we have to take care of the wounds on one aspect. We have to take care of the pain which he is suffering. We have to take care of the, psychological aspect, the miseries, because if somebody is involving the phase, apparent areas, or he is having, this distress and he has to live it for a longer time.
Quite right.
So we have to provide them a psychological support, which Iram must be, I would even love to have her in, and she must be telling us about. We also have to give them a proper nutritional care because these are, if we have a smaller cut wound, it's healed in a different way. And if we talk of a major wound, it's a bigger wound, it's beyond imagination. You consider it a small cut wound and consider it a small, a major burn wound.
For like a stove burn victim, for example.
It involves a special diet and nutritional care as well. So it's a multimodality. Right. So I think if we talk of just burn care as the wound is, it's not adequate.
Yes.
So we have to give them nutritional care. We have to give them psychological care. We have to give them rehabilitation. Their mobility issues.
So it's a sort of really complex.
It's very complicated.
Because I imagine that kind of burn kind of changes your whole life in so many different ways. So Iram, could you weigh in a little bit about trauma after something like a burn? And for example, now we're talking about disfiguring, life-changing, life-altering burns. So tell us more about trauma and how to deal with trauma, and also how family and friends of somebody who is a burn victim, how can they help support somebody who's been through that?
I think for burn victims, it's a complete life reorientation. And there are multiple studies which says that people with resilient and positive life orientation recover faster in such cases where they have stronger support system. Let's say if they see adversity and unfortunate events as a momentary and short-lived, their ability to recuperate with that particular distress is far quick than the person who is extremely depressed and having negative life orientation. So Dr. Saab is very much right in that context that for a patient, physical healing mental healing is as important as the physical care and medication. In fact, all these burn centers and hospitals should have certain certified and competent psychologists on the board so that they can take care of the levels of different distress that patients face. And as far as your question is concerned, that how family and significant others should behave with them, I think they should be taught and they should be educated on that it's not the same person. The patient's expectation and the victim's expectation from their loved one is far higher than the normal state, because previously their self-esteem wasn't challenged as much as now. So they would be expecting more, plus they are helpless as well because they just cannot do anything about it. And this helplessness bring a huge amount of depression and stress, because you just cannot do anything about that flaw that has, or maybe the challenge that has up to you, except your loved ones would make you heal faster in a way by giving you and providing you that unconditional support that it's all right, this has happened to you, but your values still matter to us and you are still needed in this world, and look into the things which are still working in your life. A lot of people like Muniba Mazari and Amy Pruvi, they people are like, they lost their legs, still they are working and they're looking at things which are working. I was going through a couple of role models. One of the Turkish painter, she had full body paralysis and only one toe, her only one toe is working, and she's creating masterpieces on that toe. She paints beautifully. So being a positive psychologist, I think our focus should be on things which are still in our hand, which are still working. Identify your strengths, keep yourself engaged. Your support system is your pillar on which you are going to regain your momentum of life back. So yes, but again, as Dr. Saab said, it's a multi-layered trauma. It's not only one dimension. I mean, you are deeply hurt on like multiple levels. Your spirit is gone, your body is damaged, your mind is lost, and there is fog that how would I be accepted and how would I, take my normal life. So a lot of support and cooperation is required on all ends. And plus, I think society has to change their demeanor towards such people as well.
I think that's very important, and that's something that we were talking about in the beginning of the show as well, that it should be a kind of, there needs to be a two-way communication between people who have suffered this kind of trauma and people around them, because a lot of times, for example, stove burning or acid attacks, these are things that somebody else does to you. And like Iram quite rightly pointed out, there's a huge degree of helplessness in that. Or if something is a genuine accident, that's also something that's out of your control. Like you mentioned previously, nobody deliberately sets out to burn themselves. Like very few people do that. So there has to be a kind of conversation and a dialogue between victims and their understanding their narrative, understanding where they stand now, and I think that's why medical professionals play a great sort of role in that kind of counseling as well.
Because if we don't give them support, many of them, they have very high suicidal tendencies. Because if at the beginning they were not, ultimately with the distortion in their body, it's sometimes intolerable.
And also, to sort of jump in here, we don't have a lot of specialized burn units in the country either.
It's, we have limited facilities available, but still government is striving more and more. We have a good burn center at Maya Hospital, at Jinnah Hospital, at Multan, and even in Karachi. And one of the very, very good, burn center is established by Army in Kharian. So they are quite good facilities, but
it's good to know. So this is for awareness also.
It is.
And I've also read that statistically acid attacks have also gone down in the past few years, which is also a positive thing.
It's a positive thing. Very true. So burn care is available, but to some extent you are very right, because at district level, at division level, the hospitals, they are not catering the burns. And these burn centers, they are having a lot of burden, like in Mayo. We have, always a busy emergency of the burns and patients, because they are referred from all these areas, from the all hospitals, and they are traveling from far-flung areas, and we are busy with them.
So what kind of medical interventions are available to burn patients right now? Because I know that skin grafting, of course, is the one I know.
Skin grafting is
like, my knowledge.
One part. And if we talk systematically and scientifically for our audience and for viewers, they can come to know that the first, second, and many of the third-degree burns, if we take good care of them, they heal by their own. We have to provide the environment. What we have and how we have to. One is we have to control pain. Why? Because burn is it's the extreme pain which one can have in his or her life. The reason is Creator Almighty Allah has said He will burn us, because He knows it's the most miserable state.
And there's so many nerve endings in the skin.
That is. And that is, the most miserable state is
very painful.
One can ever have.
And I imagine that the pain also affects you psychologically as well, like constant chronic pain. So pain management.
Pain management. And then we give them good antibiotics so that it should not be infected. There is a lot of water loss through this burnt skin because the barrier is off. So we give them a lot of fluids in the form of drips to give them adequate hydration. Otherwise, loss of water through the skin leads to dehydration and shutting down their kidneys. So we have to take care of these aspects as well. And then we have to care them in the form of like certain creams, ointments, and specialized dressings. These dressings, they are not that ordinary dressing which we are using for the other wounds. They are specialized interactive dressings. They are like some artificial like skin-like things, and they are providing a cover which is acting as a barrier between the environment and the body. And even one very interesting thing for my viewers is that we see that after burning we have certain blebs over. The blebs formation is a blessing. It will be
blebs are good.
They are good. It's surprising. Because if the blebs are formed, it means the certain parts, layers of the skin they have burned, and underneath certain layers they are intact. Which we are
and
talking
then they
about.
regenerate.
They become separate, and there is oozing of the fluid in between, and they form as a blob. It means that we are very much sure and pretty sure that certain layers of the skin, they are intact underneath.
Oh, excellent. So it looks disgusting, but it's actually very good.
It's very good. And Mina, it's again a very interesting thing for the people that these blebs, the fluid in it, it carries very good amount of, and it's rich in the amount of healing fluids. They are healing chemicals which have been exudated from the body, and they help in healing. If some bleb is formed, and if we don't tear them off and we remain them intact,
don't puncture
them, they act as a biological dressing.
Oh wow!
Because they are still having intact layer, and the wound is not exposed to the external
and
environment.
I think that's also one of those do's and don'ts where when people say that should
puncture these.
So don't puncture them. Don't puncture the blisters.
Don't puncture them because they are as a barrier, they are guards.
That's fascinating.
And they are having the healing fluid inside.
See, this is why I love science. Thank you so much, Dr. Bajwa, for being on the show. Thank you, Iram, for joining us today. Thank you guys for watching. I hope that this has been as instructive for you as it was for me. Now you know all the do's and don'ts of treating burns safely and looking after your loved ones and looking after anybody who's been through the trauma of being burned to a serious degree. If you're watching this on YouTube, don't forget to like and subscribe, and we will see you next time on the coffee table. Bye now.